Contrast-enhanced imaging is a powerful diagnostic tool, but it requires direct physician supervision, a major logistical challenge. But what if the safest way to supervise wasn't in the room, but through a dedicated, focused remote connection? This isn't a theory. CMS has officially extended its allowance for virtual direct supervision, making this a timely strategic option. This policy directly addresses one of healthcare's biggest pressures, the growing shortage of on-site radiologists. In the next few minutes, we'll break down how to apply this CMS-compliant model to improve patient access, boost efficiency, and raise safety standards at your facility. So why is this change so critical right now? It starts with access. Many facilities, especially in rural areas, simply cannot secure on-site subspecialty radiologists. This remote model operates under specific guidelines designed to minimize risk. But what exactly does CMS require to ensure patient safety during these procedures? The technology is already in place. Most facilities already use secure, cloud-based PACS systems. Virtual supervision is simply the next logical extension. At the same time, imaging volumes are soaring. Radiology groups need a way to manage this increase without compromising quality. For multi-site networks, the value is exponential. One experienced radiologist can oversee contrast studies at several locations simultaneously. This leads to streamlined operations, better staff allocation, and a significant reduction in radiologist idle time. How does this translate to savings? It's about converting fixed staffing costs into a flexible model. You use their time precisely when needed for contrast supervision. This flexibility permits extended service hours for emergency departments and urgent care, improving patient care and capturing more volume. The operational logic is sound, but what does the data say about performance? Does virtual supervision hold up in the real world? An RBMA survey provides a clear answer. Nearly a third of centers using virtual supervision reported faster response times with zero negative impacts on care. Consider a rural hospital. They can now offer the same specialized diagnostic services as a major urban center, addressing resource constraints. For an outpatient imaging center, it means optimizing schedules and maximizing throughput, serving more patients efficiently. For an orthopedic practice, it means providing comprehensive diagnostic services in-house, creating a continuous care journey for the patient. The benefits are clear, but this model is built on a foundation of strict safety protocols. So, how do you ensure compliance and prepare for the unexpected? First, the American College of Radiology is clear. A qualified, licensed practitioner, like a nurse or PA, must be physically present with the patient as the hands-on responder. Second, you need a thoroughly tested emergency response plan. This means on-site personnel are fully trained in managing acute hypersensitivity reactions. Finally, the process itself must be relentlessly developed and tested. This includes drills for response times and confirming the on-site team knows their roles implicitly. So, what does CMS require? A secure, real-time two-way communication system, a properly credentialed supervising physician, and clear documentation for every instance. Note that the radiologist's focused attention becomes a superior safety model only when combined with those on-site emergency plans. This isn't just filling a gap from the radiologist shortage. It's creating an intelligent system that turns a workforce challenge into an operational advantage. Existing teleradiology tech provides the platform. Favorable CMS policy provides the opportunity. The result expands access to diagnostic care without compromise. So, the model is proven. It's CMS compliant, operationally efficient, and built on a foundation of rigorous safety protocols. What does this mean for your facility's future? CMS-compliant remote contrast supervision is more than a workaround. It is a strategic tool to improve care, control costs, and future-proof your radiology services. It solves the access problem for underserved communities, It creates significant operational efficiencies, and when implemented correctly, it improves patient safety. With the CMS extension valid through December 2025, the window of opportunity is now. Adopting this model provides a competitive edge in service and talent management. It's time for administrators and department managers to evaluate their protocols, assess your current supervision model, staffing challenges, and technology infrastructure. Partner with experienced teleradiology providers who have a proven track record in compliant remote supervision. They can guide you through the process for a successful launch. Do not let geography or staffing shortages limit the level of care you provide. Apply the technology that allows your best experts to be everywhere they are needed, instantly. Learn more about implementing a CMS-compliant remote supervision program at your facility.